Hey, my name is Savannah, and in this video, I will be discussing the process of hemostasis. So first, a good way to think about it is like if you accidentally cut your finger, your body will go into a mode to stop the bleeding, and this is called hemostasis, which is basically prevention or stopping of blood loss. So now if a clot forms in a vessel that wasn't injured, that's not normal. That's called a thrombosis, and that's pathologic. So that's the difference between the two. But for this, we're going to be talking about normal hemostasis, and that's how your body saves you from bleeding out. So there's 4 steps. The first step is called vascular constriction. It's the first response. It's the first thing that happens when a blood vessel is injured, and that is the vessel tightens up. This is called vascular constriction. The smooth muscle in the vessel wall contract to reduce blood flow. This happens because of a local muscle spasm, chemical signals from damaged tissue and platelets, nervous system reflexes, and platelets releasing a thing called thromboxane A2, and these are especially in small vessels, and this happens within seconds of the injury. The second step is called primary hemostasis, and this is the platelet plug. And this is like a temporary patch, and it works through a few steps. The first step is adhesion. When the vessel is damaged, collagen underneath the lining becomes exposed. And then a protein called von Willebrand factor acts like glue and helps the platelets stick to the exposed collagen. The second step is shape change. Once the platelets stick, they change shape. They go from smooth to spiky and sticky, and this increases the surface area of the platelets and allow them to grab onto more platelets and clotting factors. The third step is granular release, and this is when activated platelets release chemicals like ADP to produce that recruits more platelets, thromboxane A2, which increases platelet aggregation, and growth factors, which helps with healing. This is basically like sending out that help is needed at that area. The fourth step is aggregation. More platelets come and stick together. Fibrinogen is like a bridge between the platelets. And so now we have a soft platelet plug. It's fragile, and we need to do something to reinforce it. So the overall step 3 is called secondary hemostasis, and this is where things get stronger and we form a clot. So secondary hemostasis is the coagulation cascade. It's a chain reaction of clotting factors in the blood. It starts when tissue factor is released from the injured tissue. That triggers the clotting cascade. The most important step of this is when thrombin converts fibrinogen to fibrin, and then fibrin forms a strong net over the platelet plug, and this is like keeping all the platelets in place like concrete between them. So now the plug becomes a stable blood clot. And then the final step is called clot retraction and removal. And so once the bleeding is stopped, the body doesn't want the clot there forever. So the platelets pull the edges of the vessel together. This is called clot retraction. And then when the body activates plasmin, which breaks down fibrin, this process is called fibrinolysis. So basically, they make the clot, fix the damage, and then remove the clot. Hemostasis. So overall, hemostasis happens in 3 steps: vascular constriction, primary hemostasis, and secondary hemostasis. And then there is clot retraction and dissolution. And it's a little system that is perfect for coordinated emergency repair. And that is the process of hemostasis.